My name's Lisa McCann. I'm a social worker and counsellor at Sydney Sexual Health Centre. I'm giving you an overview today of one of the KSS Key Support Services. It's a psychosocial model of care. And so psychosocial is a term that all healthcare workers, I'm sure, are very familiar with. It's something we talk about quite frequently. And in its simplest form, we're just talking about the individual in society and how the individual meets societal demands. In the context of health, we're really looking about how an individual might feel, think, experience, respond to changing healthcare needs. The model, the psychosocial model, really assumes that we're all going to experience health in a different way, depending on where we live, who we have relationships with, our financial state, kinship networks and religious and cultural affiliations, and even citizenship. It's a prefix also to a number of services that are non-medical services within the sector. The New South Wales HIV strategy, it promotes actively the principles of treatment as prevention, which is the early HIV testing, being able to detect HIV and the early uptake of HIV treatment. And there is a huge amount of evidence to show that this clearly protects individual health and population health. However, the model can't reach all people alone, and the psychosocial theory or psychosocial model really does complement the medical model in being able to engage people in their own healthcare and engage in attitudinal and behavioural change to really be focused on improving their own health outcomes. I think all of the areas like testing for HIV, receiving a new diagnosis, living with HIV are all situations that can present psychosocial stress or psychosocial challenges for somebody, and being able to provide extra support in this area can hopefully allow people to be better ready, have more knowledge, improve someone's confidence and be more prepared to, for example, start treatments and adhere to treatments. But also it engages someone in the idea of being focused on their own health outcomes to get the best of treatment, so focusing on things like health and fitness, nutrition, mood management, smoking cessation. I mean, these are all things that make health a process and make something meaningful for somebody. So there's a range of psychosocial services support. There's a huge amount of allied healthcare workers, psychologists and social workers and counsellors, and you'll find social workers and counsellors in most sexual health clinics around New South Wales. And also peer support, connecting someone to the peers and communities can really be able to help promote positive attitudes to health, to sex, sexuality, relationships, and reduce isolation and overcome social stigma, and engage in a supportive environment that really provides a lot of resources. I think if psychosocial factors aren't addressed, I think you really risk creating a barrier to achieve the goals of the New South Wales Health Strategy for an individual, but also for a community. I think it's really important to acknowledge that people need to be engaged in holistic healthcare, physiological, psychological and social wellness is an important goal of the strategy overall. Central to psychosocial theory is the idea of the individual, enabling client autonomy, individual choice, being involved in the management of your own healthcare enables someone to stay engaged in healthcare over time and hopefully afford good health outcomes for the individual and the community. I think all people who are going to test, contemplating testing or receive a new diagnosis, regardless of their apparent ability and material resources, all have a right to access or to be offered this key support service and to be assisted in being able to access support in psychological and social areas Support may be as simple as a one-off intervention, trying to get someone to a medical appointment or having treatments delivered, or connecting someone with a peer support group, or it may be much more complex than that, and it might require access to many service providers and be required over time.